Hello, this is Dean Jabs. I'm a board-certified plastic surgeon serving the greater metropolitan Washington, D.C. area to include Virginia and Maryland. My office is in Bethesda, Maryland, where we have complete surgical facilities to treat patients that need it. Let's talk a little bit about breast asymmetry. It's not unusual for women to have one breast that's different than the other. In fact, that's the norm. It's very unusual to see somebody that's exactly symmetric. Now, your breast shape is determined by a few factors. One is the chest wall and whether that the breast rests on, whether the bones are more protuberant or not. The other is the position of the nipple relative to the crease. I often see women that have had children and they said the baby took to one side more than the other and that breast got larger and smaller and thus is a little more saggy. Other times I'll see women that they say they were born that way, that as they developed, one breast developed more than the other. And I've seen patients with up to 2, even 3 cup sizes difference. Now, the difference in their breast shape and symmetry is what determines how we treat it. There's not a one size fits all. So for some women, we can augment the breasts differentially. So one side will get a slightly larger, and sometimes grossly larger, implant than the other. This helps for the volume. This can be done if the skin envelope is the same or within a certain parameters. Now, if you have one breast that's sagging and the nipple's enlarged and there's more skin, then in that side, we have to reduce the skin envelope and sometimes either place a smaller implant or no implant on that side. And the small side then, if the skin's normal, we'll place a larger implant on. This can be done relatively easily, although you have to remember that breasts, the saying is they're sisters, they're not twins. So we can never make them exactly the same, but we can get them a lot closer with this procedure. And what you can expect is that over time, they will get closer as the skin softens and the tissue relaxes. Should you have other questions, please feel free to contact us. Thank you.